yourself, about infirmary, and what it is you do.
All right, like I said, my name is Richard Andrews. I work at Infirmary Health Systems. We used to be Mobile Infirmary. We have changed about 5 years ago. We went to Infirmary Health Systems. We are a big part. I work at Mobile Infirmary Medical Center and Thomas Hospital in Medical Electronics Department. I am a biomed and coordinator of medical electronics equipment. I also have the task of administrator over the Intelligent InSites system. Mobile Infirmary is licensed for 693 beds. We run an average of 450 in this past week. As they were running the total, we're around 470, 480 right now. Thomas is licensed for 150 and an average of 130.
I know one of the things that has been very beneficial for your site in terms of the asset management and tracking that equipment is trying to eliminate the clutter from the hallways and making sure that any regulations are being followed. Could you talk a little bit more about how you're using InSites to ensure that there isn't equipment that's kind of building up in the hallways?
One of the main ways we use the system is find beds as needed. When a patient comes into ER or a patient comes into bed placement, if the patient needs a geriatric bed or a low boy bed, we have all our beds tagged. I might interject here that everything in the hospital that is connected to the patient that is movable, losable, hideable is tagged in our hospital. We have over 2,000 tags at Mobile Infirmary and approximately 1,000 at Thomas. The low boys, the geriatric beds, these type things, are tagged. When a patient comes in and requires something special, a special type bed, house supervisor, team leaders, floor managers, so on and so forth, they call EVS or they themselves will get on the system, the InSites, and they will look up and try to find that specific bed. Where its location is, they notify transporter. Transporter goes up to the floor, picks up the bed, delivers it to wherever it's needed. Therefore, in the past, we have spent, hours looking for a bed, room to room to room. This alleviates that problem. We find the bed, we get it down to the patient, get the patient satisfaction up to the room where they belong. As far as being beds in the hallway, JACO requires it cannot be in a hallway, passageway, thoroughway any longer than 30 minutes. We have a notification that goes down to transporters when any type of bed has been in any hallway or passageway for 20 minutes. Transporters are notified. They send somebody up, they pick it up, they take it to a storage area, and therefore we alleviate this problem.
Great. Now, one of the other areas of the facility that's very unique is central distribution. Could you tell everybody here a little bit more about central distribution and how that's also tied in with InSites?
Our hospital uses a central distribution for all patient equipment, feeders, IV pumps, foot pumps, this type of thing. So it is checked out of central distribution. The floor calls down, they specify what they need for that patient. Somebody comes down, they pick it up, they take it back up to that floor and they leave it there. When the patient leaves the hospital, the equipment goes to a dirty or soiled utility room. The InSites registers this and it has marked it as dirty. At that point in time, transporters are notified when anything over 4 pieces of equipment go into that dirty, soiled room, or 1 piece of equipment has been there for 30 minutes. It then notifies them, they come pick it up, they take it down to sterile processing. Sterile processing then returns it back to CD. This has shown an improvement of 12% improvement in the turnaround time of available equipment.
Just out of curiosity, I know you're in the system day in, day out. What report or what functionality for your job specifically do you find yourself using the most?
The system I use the most is once a month I'll do a report for infection control. That's the system I use the most, other than just trying to find a piece of equipment that's in the hospital that needs a PM.
Could you talk a little bit about what the infection control focus has been at infirmary, and what type of rules you have set up and why that is so important to you in the site?
We just had a brand new administrator take over the hospital, and one of her main emphasis, we have a meeting every morning, the managers and directors and so forth. They have a meeting every morning at 9 o'clock. One of her main purposes that she pushes every single morning is infection control. She pointed out that, as we all know, infection control now, if a patient's in the hospital and they contract MRSA or any of these other type of infections, that we now, the hospital, are going to pay for that. Being a nonprofit organization, that hits our pockets kind of hard. So she emphasizes this. So when a piece of equipment is removed from a patient's room and is sent to a soiled utility room, then to a patient room without going through sterile, which is our process, we receive an alert that lets us know that equipment has not been cleaned properly. We have the same notification for a room, piece of equipment from room to another patient room without going through sterile. Our process is patient through room, sterile before it is assigned to another patient. I have a report that I turn in every month, like I said, to sterile, to infection control each month. And they, at that point in time, they review it, they look over it. They then contact the manager or director of that floor and talk to them, and then give a reorientation of, this is the process we use, please start using it.
Great. If you could talk a little bit about kind of the billing process or charging and how, when equipment is used for a patient, how are you monitoring that and how does that affect the billing?
All right, back to the same deal where a patient leaves a room, then the equipment leaves the room. We basically use the same process. We've set up, Josh has set up so that when the system sees that this piece of equipment goes into a dirty room and possibly into another patient room where the floors clean it, it notifies us. Central Distribution gets an email and alert on their InSites, which they have their monitor set up every day also. They look at that, they immediately pull the card for that patient. They then stop the billing on that patient. They find out who the new patient is. They then put that piece of equipment on that patient as the new patient to start billing. That way we stop billing one patient and start billing the correct patient while it's in that room.
Excellent. Could you talk a little bit about the equipment maintenance and how the kitchen staff is going to be using InSites?
Yeah, the medical electronics department, the department that I mainly work out of, we use InSites. We have PMs that are due each month. We get printed PMs out, sheets, and I mean stacks of PMs. Like I said, most of our equipment in the hospital, patient equipment, has an asset tag on it. Towards the end of the month, we have a push to get 97% or better on our PMs, and the technicians will wait to the end of the month, the last week, to actually go out and pull equipment that's on a patient that cannot be removed. He'll find that piece of equipment using the InSites program. He'll take a piece of loaner up there, have the nurse change it out. They'll put that on. He'll bring the piece of equipment down. He'll do his PM, calibrate it, test it, do whatever needs to be done. Then take it back up to the floor so it can be put back on that patient and continue running from there. This way we get all our PMs done. Also, the InSites system helps us because everybody has a little cubby hole or a hiding spot. The floors, because they are short of equipment, they're scared they're not going to have what they need, so they'll hide this stuff. The InSites has helped us find quite a bit of equipment that we've been missing for years. So it gets more equipment out on the floors, and we have more equipment available for use. Also, the catering department, we have Morrison's as our catering department for the employees and the public. They've just recently started using the staff tags to improve pickups and deliveries to floors as needed. If an item is needed, if they need an item off that they don't have on a cart, which they carry a lot of extra items on the cart, they'll look at the system, they'll find the closest caterer that is in that area. They will page them, notify them that they need to go up to this floor, this department, and deliver this. This also helps when a patient or the nursing staff says, we never saw that patient, or we never saw that caterer, sorry, we never saw them. They can look at the system and say, well, yeah, you did, that was taken care of. So it helps in justifying that. It also, they're using it to look at time that the caterer is actually in the room. They want the patient's satisfaction to be peak for their catering. So they go in, they talk, they take what the patient wants to eat for the next 2 or 3 meals, and they spend some time in there. So this helps them, if they're having problems not satisfying the patients, they look and say, well, maybe we're not spending enough time in the room, maybe we're spending too much time in the room. So this is how we use it as far as staff tags.
Yeah, it's been really fun to see how, you know, those small wins happen, and then different departments have questions of, oh, how can I use InSites? Or wait a minute, could we try that for our team? And, you know, it's been really fun to watch that happen. Just a couple more quick questions for you. I know a lot of what we've talked about so far has been about the mobile site. Could you tell us just a little bit more about Thomas and how they're using InSites?
Yeah, we took over Thomas Hospital, I think it was about 6 years ago, we took over Thomas Hospital. Thomas Hospital has a new section like all hospitals, because hospitals never quit growing, and we have an older section. The older section of the hospital has intercom system on 2nd and 3rd floor. They do not have a nurse locator system whatsoever on the south side of the building on those floors. So when a patient needs something from their nurse, or a doctor needs to talk to a nurse about a certain patient, they have to carry cell phones in their pockets through all the rooms. Problem is, when you're in an isolation room, you got gloves on, you got mask on. I, for one, am not going to reach in my pocket, pull my phone out, and put it to my face. And this is the same thing that they feel also, because we're infecting ourselves and other people. So what we've done is we've taken the InSite tags, or the CenTrak tags, using the InSites. We put these on the actual staff, the techs, the runners, the nurses, and this way, when something is needed by a secretary, a doctor has called, the patient in room whatever now needs help, can you please go take care of them? The secretary looks up on the board, she knows exactly which room to call, and she pages that room, alleviating the phone, alleviating an all page to all rooms, disturbing all patients. We get directly to the nurse or tech we need, and we process it from there.
Great. Well, thank you for joining me on stage. Again, really, really excited to have you here. And I really do encourage everybody out there to take the time to meet Richard. He's a wealth of knowledge. And yes, thank you.
Thank you.